In this video, I want to cover why the headache or migraine flare that you've had for months or even years now still isn't going away despite all the medications, treatments, and everything else that you've tried. My name is Dr. Jacob Lane. I'm an upper cervical chiropractor who helps chronic illness patients recover from migraine, headaches, vertigo, POTS, dysautonomia, and other complex neurological conditions. I've helped hundreds of patients get out of these flares, find answers as to why they're suffering, and help them get back to their life. So, a lot of times with headaches and migraine, we know that headaches and migraine are two completely separate things. So, I'm not saying that headaches and migraine are the same thing, but a lot of the times people who experience them whenever they have a lasting headache or a lasting migraine can start to have similar symptoms. But I know that migraine is a complex neurological disease of the brain, and headache is also a complex neurological disease too. It's just a different mechanism a lot of the times. Migraine, it's a genetic condition that can happen. Headache can have different causes, like from the neck, high blood pressure, blood sugar, different things like that. A lot of the times whenever people seek us out, they've had headaches or a migraine for many years, months on end. They've been to doctors, they've had MRIs. Everyone's told them that it's probably just in their head, maybe it's anxiety, it's their stress, or they need to sleep better. They need to do X, Y, and Z, and that's why their headache hasn't gone away. Now, while yes, that may be true that sometimes those things can affect headaches and migraine flares, it's not always that simple. With these sorts of conditions, if we have someone who's been in a migraine or a headache flare for many months or years, we have to understand a concept called central sensitization. Central sensitization is basically where our nervous system or our brain becomes hypersensitive aware to information that it usually shouldn't be painful, but it becomes painful. And it becomes easier for these pain pathways to fire as they continue to fire for months and years on end. It's like, if you go and drive down a dirt road the very first time, there's no ruts or anything, or you go down like a mud road, there's no ruts or anything that very first time. But if you continue to drive down that road day after day, year after year, eventually you're going to have very deep ruts and you just know exactly where to go, and that's where you drive every single time whenever you go down that road. It's the same concept that happens in our brain. It's that those pathways, the headache nerve pathways, it's the trigeminal system that becomes hypersensitive in these sorts of conditions. Whenever those pathways fire over and over and over again for months and years at a time, it becomes easier for them to continue to fire day after day. And it just becomes something that they will do over and over again, no matter what we do to try to get rid of it. And a lot of the times we have to figure out like what is contributing to this, because there can be so many different contributing factors. If someone has autoimmunity, if they have diabetes, if they're getting poor sleep, if they have any sort of brain tumor, if they have multiple sclerosis, if they have just different conditions like that, can all affect these sorts of things. But one thing that we look at differently is something called the craniocervical junction. The craniocervical junction, it's the very top part of your neck. And a lot of the times in these sorts of conditions, the neck is overlooked. So if we look at those pathways actually converge together in the same part of the brain called the trigeminal cervical nucleus. It's actually a nucleus that lives in the very bottom portion of our brainstem or in the top part of the neck. So whenever we have this abnormal information coming from one area and it converges with another, like if we have a previous history of like a whiplash incident, a trauma, slip, fall, something along those lines, that information can converge with the trigeminal nerve. And whenever that happens, it can end up referring pain to different parts of our head. So it's that concept of referred pain. Like if someone has a gallbladder issue, they can have right shoulder pain, or if someone's having a heart attack, you can get left arm pain. It's that same concept that whenever we have something in the neck going on, we have some sort of pain pathway happening, it can actually show up in the face and in the head. Sorry, we've had a small interruption. So this is Nayla. She's going to help me finish the rest of the video because she doesn't want to leave right now. So what I was saying is that the craniocervical junction, it's the very top part of your neck. This area, it's the most freely movable and it's one of the most dense in neurological structures than any other area of our spine. We have the vagus nerve, we have the carotid artery, we have the internal jugular vein, we have other cranial nerves also as well up there. There's just a lot that happens in this very top part of the spine. So whenever there's any sort of dysfunction, misalignment, or it's just not working right, or you've had a previous history of injury there, that information, it intermixes with that trigeminal system. So the trigeminal nerve covers different parts of our face. We have three branches. We have the ophthalmic, maxillary, and we have the mandibular branch. So all of the information coming in from our face, it converges at that trigeminal cervical nucleus in the very top of the neck. Whenever we have an injury at the craniocervical junction, that information will converge with that trigeminal nerve, and it can create nociception. It can create pain. That's what nociception is pain. I have a patient that has had a headache for months on end, years on end. They've had MRIs, they've had x-rays, they've had blood work, and everything has come back normal. They can't find any answers to why they're suffering. A lot of the times it's because our trigeminal nerve has just been stuck in this pathway, and because of that, we have to look upstream. We have to look at different aspects of what that trigeminal nerve converges with to see, is there something else that's making the system stay on overdrive. So, sometimes there can be medication overuse headaches. Sometimes people have too much caffeine. And those are all things that we need to look into to make sure that there's not something else going on. But for a lot of my patients, whenever we do specific work at the craniocervical junction and we get this area into a better alignment and we normalize some of those receptors and that input going into that trigeminal cervical nucleus, we see improvements very, very quickly. I had a patient from, this was probably about 2 or 3 months ago, and she had had a headache for 30 plus years. She had been to hundreds of different doctors over the years. She had tried hundreds of different medications. She had tried every treatment in the book that you can think of, but no one ever thought to look at the top of the neck. The craniocervical junction is just an overlooked area in healthcare. Whenever you go and get an MRI, a lot of the times this area of the spine is missed. You actually miss it because those slices in an MRI are like 2 to 3 millimeters sometimes, and you completely skip over it because this isn't a very big area, but it's very dense in the neurological impact that it can have. So, what this means for you is if you resonate with this type of story, that you've been to everyone, you've tried many different things, you've got to have someone evaluate the craniocervical junction. And we do this through functional testing, and we do it through upright CBCT imaging. So another thing is that, when you get imaging, a lot of the times it's laying down, but many times people feel better laying down with a headache. So we need to do imaging whenever you're upright and you're in a position that can make the headache worse. We don't even have to go into adding in neck movements and taking imaging that way too. That's a whole different video that we can get into. But yeah, if this sounds like you need to have someone evaluate the craniocervical junction. We have a lot of free resources on this. If you want to learn more about this part of the neck, you'll be able to get a link down below to access a free PDF talking more about this area, going into the neurological impacts it can have, how it can affect headaches, migraine, and other complex neurological systems. The trigeminal cervical nucleus is just one way. There's many other ways that this area can impact our neurology, our nervous system. So it's one that we don't want to take lightly, but it's one that it needs to be evaluated. And I think everyone, I resonate with this a lot because my wife, Dr. Laporto, the other doctor in our office, she suffered from migraine and multiple concussions, and she figured out she had a neck injury, and this was the cause of a lot of her symptoms. We got this corrected, and now she's in a much better spot. Now she can help patients get better too. So it's really cool. If you have questions about this, feel free to leave them in the comments. I try to answer everything that I can. But download the free resource below, comment on this post, subscribe, and we'll be back in the next one.